As we age, physical changes and health conditions can affect the way we walk and move and can contribute to falls. So today we're talking fall prevention, and I'm here with Dr. Mona Fazzini. And basically, there's a lot to know, and you might be suffering with issues and not even know it, right?
Yes, that's possible. As we grow older, we can lose muscle mass, and if we don't actively go after strengthening our muscles and staying active, the body will gradually become a little weaker.
Right, and this can contribute to some serious injuries from falls, couldn't it? So it's important to keep strong.
Yes. In fact, hip fractures and wrist fractures in the elderly are quite common, and just a fall, even if it doesn't result in a fracture, can really affect someone's self-efficacy for movement or their confidence level for mobility, and that affects how much they tend to move in the near future. So it's very important for people to stay strong even as time goes on, so that they can continue to do the things that they love to do.
Right, and there's nothing more maddening than feeling like you can't move and you can't do those things. Now, you were giving me some examples earlier of things that you should be able to do. Can you show us some of those?
Yes. For example, one test that I have some of my patients do is a calf raise or a single leg heel raise. I have them stand, and of course they can use their hands to support themselves for balance, and I see if they can go up and down on their toes without flexing at the knee and with good form and posture. And if they can do this about 20 to 25 times in a row, even if their calf muscle aches a little bit, that's a good sign that they are able to lift their body weight up with that one foot. If someone does just a few, less than 5, less than 10, or if someone does even one but their knee keeps flexing, that's a sign that the body is compensating for weakness in itself. So there's exercises we give people just to show them that, you know, these are things you can do in your own home. They don't require any special equipment, and they take very little time, and you can incorporate it into your daily routine.
And you gave us some other examples, just as simple as sitting up in a chair. And we have Anne over here who was one of your patients, and she can show us and tell us, you know, what this shows you.
So the sit-to-stand exercise has many modifications, but ideally we see if someone can sit and stand from a chair without arms and without using their hands. So in Anne's case, she's at a point now where she can do this sit-to-stand, you know, with her arms crossed at her shoulders. She can maintain good form. She doesn't tip backwards. Her balance is good. And she can do this repeatedly, more than 13 to 15 repetitions in 30 seconds. And that's a very good sign. It shows that her risk for falling is low because the functional strength of her quads is good. And this is a general statement I'm making, but for Anne, this was a perfect exercise, one of the perfect exercises for her.
And speaking of Anne herself, you know, why was she brought in here and what did you work on with her?
So Anne came to us with a diagnosis of scoliosis and some back pain. So we started off working with the back pain. And in a couple of visits, she showed tremendous progress. And I would attribute it to the fact that she's highly motivated. She wanted to get better. She did everything I asked her to do. So whether it was an exercise, a stretch, or a modality that we recommended, she was, you know, very in tune with that. She attended all her physical therapy sessions. So after the first few sessions, we progressed from working just for the back pain, because she came in one day and said she has no back pain and has not had back pain in a couple of visits. But she wanted to continue her therapy to make sure that she could get as strong as she could, almost as an investment into her future. So we started working on reducing her risk of falling, and we tracked it week by week, you know, testing different muscle groups, and just tested her balance, her functional strength, her endurance, her stamina. And then by the time she was discharged, I was able to record and actually even show her that she had truly reduced her risk of falling, and it improves her quality of life. There's a lot of things she can do now that she either was not doing before or was doing with some difficulty. So.
Well, it sounds like you get gold stars. And when you're talking about back pain, I think a lot of us out there deal with some sort of back pain, and dealing with this and doing this prevention, this has made a world of a difference for you, hasn't it?
It certainly has, yes.
So tell me about what you thought of Mona and Rehab Associates.
Mona was just wonderful, and everyone here was the different technicians I worked with, assistants, they were just terrific, very encouraging, very patient, and I could observe how they reacted to other patients who were here, and it was always with a great deal of care and concern.
And she gave you an exercise prescription for the future. Have you been doing it?
For the most part, yes. Not as often maybe as she would like for me to, but I do, and it's not difficult. It's easy. The equipment is in a drawer, and it helps. I can tell a real difference.
That's great. And Mona, speaking of the exercise prescription, you are someone that can give that to folks. And, you know, it is good to come to someone like you to get an idea of your weaknesses and what you need to build.
Yes, I think there's so much information on the internet out there, and it's a good thing. However, you have to sort through it intelligently. And what a physical therapist can do for you is do an assessment. And I mean a full body assessment, like for fall risk, for example, since we're talking about this. And when I see patients, I assess their risk for falls, and then I give them an exercise prescription that they can handle currently. But as their therapy sessions go on, I progress that exercise. So they're not doing the same exercise that they did when they first came in. So we progress it and we track their progress. And I like to convey the results to the patients so they know that they're progressing. You know, I give them objective and subjective information as well. And by the time they're discharged from therapy, I want them to have an exercise program that is, one, challenging, two, they should be able to incorporate it into their daily routine. It should not require much, and it should not be an expense of too much time or money. It should be something that's feasible for them to do. They should be able to do it indoors if for any reason they can't go outdoors. And I say this because I've had patients say, well, it was raining, so I didn't go out for a walk.
Right.
Well, there's ways to get around that. So I just want to make sure that people have the tools that they need to stay healthy and strong for the long term. You know, there is aging, and then there's normal aging. So old age in itself is not a disease. And I want to make this very clear to a lot of people, because sometimes I have patients that come in and they say to me, I'm old, therefore I ache, or I'm old, of course I'm weak. And I want them to know that old age in itself does not have to mean weakness or disease, not in itself.
Very good information. And to learn more about fall prevention or ways to build your strength, call Rehab Associates at 855-722-8478 or go online to racva.com. And we'll be right back.